Okay, so gender dysphoria normally occurs among persons who are not having the same gender identity as their sex at birth. So this is among transgender and non-binary persons. And the reason for that is they are not comfortable with how people may be treating them or with how their body looks, because this is not consistent with their gender identity. So for example, someone identifies as a woman, they are a woman to their mind, but what's happening is that they were born as a man with the sexual characteristics, physical characteristics of a man. And so when someone says sir to them, they're not comfortable. And the opposite is true for those who are born female and yet they are, in their identity, they are a man. So they're not comfortable being called ma'am on the other hand. So that's when there's gender dysphoria, this discomfort, and sometimes it can lead to depression and other mental health issues. So it can go from something that just they're uncomfortable and they are therefore not really comfortable socializing sometimes because people would misgender them in terms of their gender identity. And it can go to the extremes of being depressed, not even wanting to go to school for those who are still students, or having trouble interacting with other people and going to work. So with birth control, we're really talking more about that's being used, the oral contraceptive pills, by trans women, or the sex at birth is male, and then they went ahead and tried and wanted to feminize, so they're taking the birth control pills. And these are being used commonly because they are widely available everywhere. But the problem with using that is, although they will work to feminize the person because they generally have estrogen, which is the feminizing hormone, and progesterone, some of which can counteract the natural testosterone in their body, what happens is that these pills are not the proper form and the proper dose for transitioning with gender-affirming hormone therapy. So it's actually not safe because aside from the doses are not right, they usually take this in an unsupervised manner. So they may take a lot more just to achieve the goals that they want to achieve in terms of feminization. And on the other hand, they may also be under treating themselves, which can also lead to problems with some lower testosterone and estrogen levels, which can lead to thinner bones and also some issues. On the other hand, if it's too high, it can lead to breast cancer and clotting disorders. So it's not really safe because it's not for that dose, for that transitioning that they need to do. So if they have the gender dysphoria and there are criteria to meet for that, and therefore they would want to transition with the gender-affirming hormone therapy, for trans men, they do use, or they should be using, testosterone for the transitioning purpose, yes. So there are other ways also of managing aside from gender-affirming hormone therapy. The transitioning part is the important part, and part of that, of course, is changing their personal and their social. So they may change their physical appearance. Trans women can wear makeup, can start to dress more feminine, and also for trans men, they may have shorter hair, they may dress in a more masculine manner, and they're also changing their names, and also that will change their interactions with people socially. So that's part of the transitioning. In fact, preferably that starts first, the coming out to oneself and coming out to everyone else, because of course the physical changes that comes with gender-affirming hormone therapy will also lead to changes in how they think of themselves and how the other people would treat them and think of them. And so if they're not yet out, that can cause problems. And so the hormone therapy is not the first means of treating gender dysphoria, it's just part of that. Of course, also the acceptance of oneself. If they need to see a psychologist or a psychiatrist to be more comfortable with themselves and to help them with the transitioning process and the gender dysphoria, then yes, that's also part of it. So it's not just the affirming hormone therapy. And the surgery at the very end of it is also part of transitioning. Some people choose to do that first. That's not necessarily the recommendations in terms of the guidelines. But again, that's also part of the management of gender dysphoria. So I'm an endocrinologist, and I have had patients who come to me not because they want to take the hormones, but they want to confirm their gender identity. They're still in that process or in that journey of figuring out their own gender identity. And that's one of the first things we have to do for them. I did not think I would be an expert in telling people or helping people through that process of identifying their gender. But apparently, when you've seen enough, then they sort of look to you for guidance in that manner. So we do have our psychiatrists on board also to help our transgender and non-binary persons figure out their gender identity as well. And it's part of the process. It's them who have to figure that out. Aside from that, in terms of the gender dysphoria, so it's the coming out to oneself, coming out to others first, that's important. And then in terms of the hormone therapy, we're also guiding them, myself and other endocrinologists in the group, to be able to safely use these hormones and medications so that they can masculinize or feminize, whichever the purpose that or needs to be, and they can do it in a safe manner, as well as in a manner that they're not either over-treating, which is the more common problem, or under-treating themselves. And also guiding them so that sometimes they come with their parents, their friends, and that helps also in terms of the bigger issue in the social group, so that everyone understands, because there's that discussion rather than just the physical changes occurring in the patient.